we're at a time in history where technology is moving so quickly that sometimes it's moving faster than, say, guidelines. And let's take ATA guidelines, for example. Is there a case that you have treated or a colleague has treated where the guidelines was recommending one thing, but you knew and it did result in something better, even though the guidelines was saying treat it a different way? Is there such an example?
Yes, actually, almost every day, because just think that in the liver, from the first case, it took about 20 years for ablation to be into the guidelines. And at the present, thermal ablation of liver cancer is the first choice in the guidelines instead of surgery for tumors smaller than 2 cm. It took 20 years, but now the first choice is ablation instead of surgery. In the guideline for kidney, we are considered as an alternative option only for patients refusing surgery. But in my everyday practice and with our surgeons, if a patient is suitable for ablation, we just discuss with the patient, we provide counseling with advantages and disadvantages, and decide with the patient, even if guideline suggests surgery first and ablation only in case of refusal of surgery. For thyroid, what I did has been, after some years of facing this problem, has been to write the guidelines. Because at some point, I decided with the European Thyroid Association and CERSI that we needed a specific guideline for malignant thyroid disease. And I put together a group of people and we wrote the guidelines specifically for malignant. But guidelines come after a lot of clinical experience. And in such a quick moving world, very often are quite late.